In my view, health care is a human right, not a privilege. And we will pass, whether the insurance companies like it or not, Medicare for all.
We need less government control, not more government control. In fact, their gold standard for healthcare reform is really socialized medicine.
The current U.S. healthcare system is failing the people. 28.5 million Americans, composing 8.8% of the population, never possessed health insurance in 2017. An additional 26% were underinsured. As a result, 41% of American adults carry medical-related debt.
Too many American families still must make the impossible choice between going to the doctor or putting food on their table, filling their gas tank or refilling a prescription.
Almost 45,000 American deaths each year are due to poor or delayed health care for the underinsured. Unfortunately, even those with adequate coverage have died as they have been denied care. For example, there was
a young teenager that needed a liver transplant, and her parents had gone through many hoops to get her to qualify. She died before she could get the liver transplant because the day that they made the decision to allow her to have the liver transplant was the day she died.
Aside from denying care, insurance companies require patients to pay
thousands of dollars in deductibles, and they go and get care, and they get bills that they cannot possibly afford.
Additionally, those with insurance have to pay monthly premiums and fulfill co-payments.
We need a way to create healthcare that everybody can access that is affordable.
A single-payer system would eliminate private health coverage, subsequently providing available and affordable health care.
Getting rid of private insurance companies would help a lot because what they're doing is they're shifting the cost to patients.
Those against Medicare for All, a piece of legislation in Congress which would introduce a single-payer system, claim that people would be hesitant to abandon their private insurance. On the contrary, a 2021 survey by Morning Consult and Politico found that 55% of American voters support Medicare for All and instead are concerned about retaining their current doctors.
People want to have the choice of which doctor they see, what kind of treatment they get. In our current system, we don't have those choices.
Eliminating private coverage would allow freedom when choosing doctors, as the government would reimburse all medical practitioners. While Medicare for All is very idealistic, an important factor to consider is its cost. A 2019 study by the Urban Institute predicted that it would cost an additional $34 trillion in federal health spending over a decade to fund the program.
The amount of tax revenue needed to do that would be enormous. We've looked at that at the state level, at the federal level. You'd have to have about a 20 percentage point increase in taxes.
Americans will not tolerate insurance going away and will not tolerate taxes going up. They want to keep their health care plan and they want it at a lower cost.
However, a study by the Committee for a Responsible Federal Budget suggests that single payer could be funded through a combination of increases on corporate consumption, payroll income, and wealth taxes, among other revenue-generating mechanisms.
While, depending on your income, your taxes may go up to pay for this publicly funded program, that expense will be more than offset by the money you are saving by the elimination of private insurance costs.
Presently, administrative costs excessively waste money in our health system, as care providers must pay to
fill out forms, for one of 5, 10, 15 different insurance companies.
So we're always trying to work through how do I help you and still stay within the guidelines and the rules of those payer sources.
A single-payer system would save on administrative costs. Currently, private insurance groups spend approximately 17% of their revenues on administrative fees, as compared to the 6% estimated by the Urban Institute, which would be used similarly in a single-payer system. In order to save further expenses associated with treating avoidable health complications, the government may expand preventative care under a universal system. This would lead to a healthier population with a longer lifespan, thereby lessening the health disparities which presently afflict the underinsured.
Here's what you get from a Medicare for All universal healthcare system. First of all, you get comprehensive benefits like medical, dental, vision, mental health, prescription drugs, long-term care. All of this with no copays, private insurance premiums, or deductibles, and you get more choice than you have now because there's no out-of-network hospital or doctor.
The pervading inequalities of the current American healthcare system, which provide challenges for both doctors and the majority of their patients, would be fixed by single payer. If we were elected to Congress, our first issue to address would be the problems in the U.S. healthcare system by advocating for the implementation of Medicare for All to improve the health of our nation.